Hello, my name is Tim Thomas. I'm a licensed physical therapist with my doctorate in physical therapy. I'm currently working at a private outpatient physical therapy clinic close to Ocean City, Maryland, called Eastern Shore Physical Therapy, located in Berlin, Maryland. As a result of this current pandemic with the coronavirus and many Americans being afraid to leave their homes, my current employer, Martin, and myself thought it would be a good idea to share a video with you. This video will include our most popular exercises that we give out to our patients for them to complete at home in order to improve their overall quality of life for anyone suffering from low back pain. So let me start off by saying there are a lot of different pathologies that can occur in our lumbar spine, and some exercises may be better for one pathology compared to another pathology. So it is always best to see a physical therapist first to find out what exercises you should be doing and what exercises you should be avoiding. However, everyone is different, and you should always treat yourself based on how you present and not based on your entire plan of care solely on the pathology you have. So for the purpose of this video, I'm going to show you how to treat yourself based on how you are currently presenting to different tests. It is also going to include exercises for common issues, along with exercises that will help just about anyone with low back pain regardless of what is causing it. So one of the objective measures that I do as a physical therapist during many of my initial evaluations is something called repeated movements. Repeated movements are a set of 10 in either lumbar flexion, which is bending forward, or lumbar extension, which is bending backwards. If any of these movements make your symptoms worse, I want you to stop. But if any of these movements make your symptoms better, then you may have what is called a directional preference, which is good. Having a directional preference means that you should base your exercise program on doing exercises into that direction and avoid doing exercises that take you into the opposite direction. So basically, do what decreases your pain and avoid what increases your pain. This information and exercises that I am going to share with you is coming from the 7 years of college and undergrad and grad school to get my doctorate, my clinical instructors throughout my schooling, and lastly, personal experience. I used to suffer from chronic low back pain myself that I had for 10 years. Towards the end of the 10 years, I learned that I had a directional preference, and that each time I would do a certain exercise, I would instantly feel better for a few hours. I then learned the importance of core stabilization and was able to strengthen my musculature that provides stability to the spine, and my low back pain has been pain-free ever since. Before we get started, I now want to talk about something called peripheralization and centralization. These apply to any of you that have sciatica, which is numbness and tingling down into one or both of our legs. While doing these exercises, you should not only be paying attention to if your back is getting better, worse, or staying the same. You should also be paying attention to if the pain in your leg is getting worse and shooting farther down your leg, or getting better and localizing to closer to your low back. A few people will get centralization of their symptoms if their leg or their leg pain improves, but their low back pain increases. That is actually still improvement and maybe the direction that you should be going into. If any of these movements can make your symptoms in your low back or leg better or worse, that is good and means that physical therapy and exercise can help you. Okay, let's get started first. I want everyone to write down how much pain they are in from 0 to 10. 0 is no pain at all, and 10 is the worst pain imaginable. Also, write down if you have sciatica and where you're currently noticing it. So I'll give you guys a second to just jot down real quick. Let's say 7 in my low back. Let's say I also have sciatica shooting down my right leg to my ankle. Stops at my ankle, never into the foot. So I wrote that down. Now I would like everyone to stand up, keep your legs straight, and I want you to bend forward the best you can to try to touch your toes. So I'll do it with you guys. We're going to go down as far as you can, back up to neutral. Don't go past neutral. That's 1. We're going down, touching the toes. That's 2. Down, 3. Down, 4. 5, 6, 7, 8, 9, and last one, 10. Okay, now write down standing lumbar flexion on that same piece of paper that you wrote down before. And besides it, you're going to write feeling better, worse, or the same compared to the number you wrote down before. Also put C if you notice centralization. So therefore, if I only notice it here, that's centralization. So never going past my knee. So maybe it's in my low back, it's in my upper leg, but not my lower leg. That's centralization. I'm writing down C. However, if you notice peripheralization, so therefore, let's say before this, I noticed it in my low back and I noticed it down to my knee. I did those 10 forward. Now I'm noticing it all the way down to my ankle. So write down P if that occurred to you. Okay, now I want everyone to put their hands on their hips and bend backwards 10 times. So hands on the hips, and then you're going backwards 10 times. So 1, 2, try to go as far as you can each time. 3, obviously make sure you're safe doing this. If you don't feel comfortable, if you feel off balance, I want you to hold on to a wall. Stand behind something. Make sure you're not gonna fall over. All right, so after you did 10 of those, you're once again going to write down if you're feeling better, worse, or the same. Also put down C if you notice the centralization. Write down P if you notice the peripheralization. That one was called standing lumbar extension. Okay, so now I want everyone to lay down on their back, on the floor, or their bed. And what we're going to do is double knees to chest. We're going to do that 10 times. All right, so what that looks like is you're laying in, this is called the hook lying position, and you're bringing your knees up to your chest and back down. So that's 1. 2, try to go as far as you can. 3, 4, if you're not able to do this 10 times, then what you can do is you can use one leg and you can help assist your leg with your opposite hand. So 10 times. And then after you're done with that, once again, you're going to write down if your back is feeling better, worse, or the same. You're also going to write down if your symptoms centralized or peripheralized. So write down a C or a P. Now safely and slowly, I want you to flip over onto your stomach. So if you're able to prop up onto your elbows for a full minute, and then you're going to write down if your symptoms are feeling better, worse, or the same. So what that's going to look like is you're coming on your stomach and you're just propping up like this. And you're going to hang out there for a full minute. If your symptoms aren't getting worse, what you're going to do is you're going to jump into something called prone press-ups. What those are you're getting into the push-up position and you're pushing yourself up, but you're leaving your pelvis, your bottom half, still on the floor or the table or the bed. So it's going to look like this. You're doing 10 of these. If your symptoms stayed the same or were getting better with you just propping up onto your elbows. If this is making your symptoms worse, I want you to stop. I want you to get back up. But if not, then get back into this position and finish your set of 10 of the prone press-ups. This helps a lot of people with certain pathologies, but it's not going to help everyone. So see if that centralized your symptoms, if it peripheralized your symptoms, or made the back better, worse, or the same, and then write that down. Okay, so now look at what you wrote down. You should have four different lists. You should have the first one, which is standing lumbar flexion. You should have the second one, which is standing extension. You should have the third one, which is the double knees to the chest, bringing both of them up. That's the same thing as another flexion-based exercise. And then you should have the one where you're prone propped and or the push-ups. They're called prone press-ups, so it's not the same thing as push-ups. And then you want to compare all four of those. If one of them has more betters than the other. So let's say the standing extension decreased my low back pain, so I wrote down better, and so did the press-ups. I wrote down better. That's a directional preference. You want to continue doing those exercises that help. However, if your exercise is going forward, you wrote down better, or bringing the knees up to your chest made your symptoms better, then you now have a directional preference into flexion, and those are the type of exercises you should be doing. So if flexion was your directional preference, you can get a chair and then start your plan of care. So any of those exercises that we already did are your starting exercises. So if flexion was your plan of care, what we can do is sitting flexion exercises. So just sitting in a chair, going down, back to neutral, back up, down, back up. Doing that 2 sets of 10 is a good starting point. Then I would lay back down. I would do my double knees to chest exercise. I would do this. I mean, if this helped my symptoms, it just makes sense that you would want to continue this in your plan of care. So I would do this 2 sets of 10. And these are exercises that I would be doing daily, each morning, once when you wake up, or at another time before you go to bed. Okay, so if extension was the directional preference that you felt better in, you could do some standing extension exercises. Prop up onto your elbows for a minute. Just hang out there until your symptoms kind of calm down. Once you feel like, okay, propping up on your elbows is gotten too easy, I want to move on, then do press-ups just on your elbows. You don't have to get into the push-up position yet. Once you feel comfortable with that, so after you do this for a week, then you're going to switch to prone press-ups. So you're going all the way up like this, 2 sets of 10, all the way down, all the way up. So you would do that for a couple weeks. And then if that gets too easy, then you can come as far up as you possibly can, or have someone else apply some pressure to your lower back while you're doing that. Okay. So, if you didn't notice a directional preference with any of the above, that doesn't mean that exercise isn't for you. It just means that you don't have a directional preference, and that's fine. For those of you that had sciatica and didn't notice any change with repeated movements, there's a possibility that you have something called piriformis syndrome. Not all of you will have piriformis syndrome, but I mean, in 50% of the population, the sciatic nerve travels directly through a muscle in your buttocks called your piriformis. So if that muscle gets too tight, it can impinge on your sciatic nerve and cause pain down into your leg. For those patients, they need to elongate the muscle fibers in their piriformis muscle, which I will show you now. So in order to stretch your piriformis muscle, you want to lay down. This is called hook line position. You're going to bring your one leg, the ankle of that leg, onto the opposite knee. And then you're going to grab a hold of your knee, so this is my right knee, with both hands, and pull it towards your opposite shoulder. So my right knee is going towards my left shoulder. You're pulling it until you feel a light stretch. Light, prolonged stretching is going to be better than a short, ballistic, all-out stretch. And then relax. That's called a piriformis pull. There's also a piriformis push. I like the pull better myself, but this is another one. So you're just putting your hand on your knee and you're pushing it away until you once again feel a stretch. So you can mess around with both of those and see which one you prefer. So if you can elongate those muscle fibers in the piriformis muscle, a lot of times that can decrease the impingement for those of you that have the piriformis syndrome, and then decrease the sciatica as a result. All right, so for those people, stretching exercises are something that you can do daily. They recommend 20 to 30 seconds, 2 to 3 times each day. But don't overdo it. I mean, nothing should be painful. Okay, so now I'm going to move on to exercises that I believe is helpful for anyone with low back pain and could be related to degenerative changes or arthritis. Sometimes when it comes to arthritis, motion is lotion, and the more we move those joints around, the better you are going to feel. This exercise is called lower trunk rotations, and I'll show you this one. Once again, we're laying down in the hook lying position. That's with our knees bent. You're going to bring your feet together. You're going to bring your knees together. And then you are going to let your legs fall to the right as far as you can, and then to the left as far as you can. And you're just going to go back and forth to the right, and then to the left. Good. And now let's say you had pain going as far as you can. I don't want pain. Don't go quite as far. So just going side to side like this. A little less motion is going to be okay for you if you did have pain or discomfort with that. That's going to move some of those facet joints in our lumbar spine. Facet joints where one vertebrae sits on top of another vertebrae. That area is a facet joint. Okay, lastly, I'm going to show you a few exercises that is going to help just about anyone with low back pain that is motivated and willing to stick with their exercise program for 4 to 6 weeks. If it means that they're going to notice significant improvement in pain and strength by the end of that 4 to 6 weeks. These exercises are called core stabilization exercises and are going to target the musculature that is going to help stabilize our spine and take pressure off of the painful locations. All right, so a posterior pelvic tilt is the best starting exercise for learning a core stabilization program. This exercise is often done incorrectly, so I will slowly walk you through how to do it correctly. I'll start off by talking about the pelvis and how there is a little bit of movement into what's called an anterior tilt or anterior rotation, which looks like so, and a little bit of movement the opposite direction into what's called a posterior tilt, which is going back like this, or a posterior rotation. So there's not much movement, but there is a little bit there at the pelvis. The posterior tilt, so you coming backwards with the pelvis, think of the pelvis like this, you going backwards is the motion that we want to do with this exercise. Okay, so we're going to lay down on our back on our bed or floor, and first couple sets I want you to do with your hands under your low back. And then tilt your pelvis back and hold, which I'll show you now. All right, so we're putting our hands down underneath our low back. We're bending our knees into that hook lying position. Our feet and our legs are together. And what you're doing is you're taking your belly button and you're pushing it down into your hands so that you're flattening your back out. So you should be rotating your pelvis posteriorly, and you should be contracting your core and keeping your abdominal muscles nice and tight without bringing your buttocks off the table. So what a lot of people do is a bridge. They kind of pop up like this. That's not what we're looking for. We're just looking for a core isometric, which is you contracting your core by pushing your back down into the table. And then you're going to hold that for 6 seconds, and then you're relaxing. And you're pushing back, you're holding, you're holding, you're holding, holding, and then relaxing. So the literature says that 6 seconds is that magic number, and do 15 sets. Strengthening exercises are slightly different than flexibility exercises. You don't have to do these every single day. You can do it every other to give the muscles some time to relax. However, you can do it still once in the morning and once before you go to bed if that's a routine that you're kind of used to. All right, so once this exercise becomes too easy, you can progress it to an exercise called a single knee to chest isometric. I'll show you that one right now. So once you have the proper technique for that posterior pelvic tilt, you can into a lot of your other exercises. So the first thing you want to do for this single knee to chest isometric is tip the pelvis back, contract your core, keep your abdominal muscles nice and tight, bring one of your knees up, meet that knee with both of your hands, and push into your knee with your hands at the same time your knee is trying to come up towards your chest. But you're not letting it because you're pushing that down. That's really going to cause your core to contract even more than just without that. So, okay, right now I'm relaxed. Now I tip back, so I did that posterior pelvic tilt. I'm bringing my left knee up, I'm meeting that knee with my hands, and I'm pushing into it. And I'm holding that for 6 seconds now. And then I'm relaxing. So that's a progression from the posterior pelvic tilt. A progression from that is something called dead bugs. Dead bugs are where you're in this position again, hook lying. You are tipping that pelvis back, you're contracting your core, keeping your abdominal muscles nice and tight, and then you're taking your hands and coming down to your knees. You're coming up and then down. You're coming up and then down. So for this one, you can have your head just nice and relaxed. You don't have to be kind of doing a sit-up while you do it. You can actually just sit back and relax and do it like so. Once this exercise gets too easy, if this exercise gets too easy, then you can take a weighted ball. It doesn't have to be a medicine ball like this. It can be anything that has a little bit of weight to it. And then you're going to come all the way up, all the way down to the knee. Once again, you're not just doing this just right, left, right, left. You're doing this with that core contraction. So contract your core down to the knee, up, down to the knee, up, down to the knee. In time, this is going to strengthen those deep muscles that are going to stabilize your spine and get you better. Okay, so I hope some of these exercises are able to help you guys out. And if you have any questions or want to set up an initial evaluation or a free discovery visit with myself, please don't hesitate to call Eastern Shore Physical Therapy. I'm more than happy to help. Our number here is 410-641-2900. If not, then I hope these do help you, and I hope you have a good rest of your day. Bye.